Equine recurrent uveitis. Equine means it's related to horses. Recurrent means it occurs in episodes. And uveitis means it's an inflammation of the uvea. The uvea consists of the iris, which controls the size of the pupil, the ciliary body, which produces fluid in the anterior and posterior chamber of the eye, and the choroidea, which is the vascular supply of the eye. Uveitis is also called iridocyclitis or moonblindness. Causes of recurrent uveitis. First of all, antigenic isoforms. Recurrent uveitis can be caused by not expressing certain isoforms of eye antigens during the embryonic selection of non-self-specific T lymphocytes. Non-self-specific T lymphocytes are lymphocytes that are programmed to not attack self-antigens, which means your own body. The second cause is an infection with leptospirosis, which will be explained later on. And lastly, an infection that damages the eye, and thus release hidden antigens. Hidden antigens are places in your body where antigens are hidden from your immune system, with, for example, a membrane. Once released, your body won't recognize these antigens and attack these antigens with antibodies. So first of all, antigenic isoforms. Your immune system fights the wrongly exposed antigens with antibodies. These wrongly exposed antigens exist because of an error in the embryonic selection of T cells in the thymus of the horse. During this embryonic selection, the premature T cells are exposed to all of the self-antigens that exist in your body, so they won't attack self-antigens. When this goes wrong, your immune cells will attack these antigens. Because of these antibodies that react to the exposed antigens of the uvea, you will get an inflammation of the uvea. This inflammation will attract all kinds of immune cells. Immune cells like macrophages, neutrophils, B cells, and plasma cells will cause uveitis. Eventually, this specific antigen that was wrongly exposed and attacked will be destroyed by the inflammation, and therefore uveitis will be cured. But because of the epitope spreading, a new antigen will be attacked, causing a new episode of uveitis. So epitope spreading means that a new antigen will be attacked by autoantibodies. Auto meaning yourself. This will result in uveitis recurring in episodes. Leptospirosis. Leptospirosis is a bacterial infection that can infiltrate many organs. If it infiltrates the eye, it can cause uveitis. When the Leptospira bacteria infiltrates the uvea, it produces two proteins, A and B. Protein A is very similar on antigenic level to the ciliary body and the lens of the eye. Protein B is very similar to the antigens of the retina. Because of the infiltration of the bacteria in the uvea, immune cells will be attracted. B cells are amongst these immune cells that will be attracted. They will produce antibodies to the A and B protein. These antibodies will cross-react to the antigens of the ciliary body, lens, and retina because of the similarity between the antigens. The reaction causes inflammation with infiltration of inflammatory cells. After resolving the inflammation, again there will be epitope spreading, as in the first example, resulting in uveitis recurring in episodes. Lastly, an infection of the eye. After an infection of the eye, which can be caused by many pathogens like viruses or even blunt trauma, the eye will be damaged, which causes a release of hidden antigens. Your immune system will react to these exposed hidden antigens by forming autoantibodies, which means antibodies attacking your own antigens that were released from your eye, therefore causing inflammation, attracting inflammatory cells. These antigens will be destroyed, resolving uveitis. But again, because of epitope spreading, there will be new hidden antigens released, causing a new episode of uveitis. The symptoms of equine recurrent uveitis are pain. The eye will be extremely painful and the horse will try to shut its eyes as much as possible because any light will cause pain. This is called photophobia. there will be an increased amount of tears that will be produced, corneal edema, which will give the cornea a gray-blue color, meiosis, constriction of the pupil muscles, blindness in case of leptospirosis and the retina is attacked, deposition of fibrin in the eye, cataract, clouding of the lens because of the deposition of water, protein and crystals in the lens, and it happens in episodes and it worsens with each episode. Therapy: atropine to induce mydriasis, the relaxation of pupil muscles, which is useful for two things. First of all, to improve the drainage of fluid in the anterior and posterior chamber of the eye, and also to prevent glaucoma. The second reason is to prevent the adherence of the iris to the lens. If it does happen, it will result in blindness and glaucoma. Analgesia, to reduce the suffering of the horse. A protective mask will prevent any light from entering the eye and causing discomfort, so a combination of mydriasis and the protective eye mask is essential. And lastly, corticosteroids and non-steroid anti-inflammatory drugs to halt inflammation. There is no specific test to diagnose recurrent uveitis. The typical symptoms and the typical episodes of the symptoms will give you the diagnosis. The differential diagnosis for recurrent uveitis is traumatic uveitis. You differentiate these two by the episodic character of the recurrent uveitis. Besides that, the symptoms between these two are pretty much the same.